Hello, my name is Dr. Patricia Coughlin, and I want to talk to you today about an issue that I think is really important to understand. And that is, how can I put this? Our own level of conscious awareness and the level of conscious awareness that we are offering to our patients or trying to help them develop. In particular, I'm talking about victim consciousness. Many of our patients come for help stuck in the role of victim. Life has happened to them. They do not see themselves as agents of change, as effective, as powerful. Unfortunately, many therapists end up supporting the role, in a sense, of the patient as victim, and also invite blaming others for the plight of the patient, in particular blaming parents, as if the reason a 45-year-old man is behaving as he is because one of his parents did or didn't do 40 years ago. Now, while certain patients have in fact been victimized, abused, neglected, and that needs to be acknowledged, that's what happened. The only thing that's really therapeutic is helping the patient own and deal with their feelings about what happened and what they've made that mean. If we in any way invite the patient to stay in the role of victim and continue to blame others for their difficulties, we are supporting them to be helpless and again to stay at the level of consciousness where life is happening to them. There's no agency, there's no empowerment there. And certainly it seems to me that what is therapeutic is helping patients begin to see that their life happens through them and by them, by their own choices, by the way they're dealing with their own feelings. And this is what we can really help them with. And in so doing, really facilitate a significant level of growth, both emotionally, but also in their level of consciousness, where they're able to step up into taking responsibility for their lives and no longer using the past as an excuse. So I think in order to help patients with this, we really have to check with ourselves, what is our level of consciousness? And are we in fact also stuck in what's been called the triangle of drama, which is looking at life and relationships from the position of the victim, the perpetrator, and the rescuer. So if you are in any way joining the patient in seeing themselves as a victim, you only have two possible roles to play there. And of course, many therapists are happy to get into that position of the rescuer, the hero, the good one, the good parent. But if you fail in that, you will suddenly become yet another perpetrator. So there's no way to operate, to function in a healthy and empowered way when in that triangle of drama. You're just going to keep recycling and changing positions from I've been victimized, so now I'm going to get my revenge and be a perpetrator. So the only way out of this is to assume full responsibility as an adult for how we handle our own feelings, for our own choices and for our own behaviors. So I really urge you to think about this and to be mindful of whether you're falling into the trap of seeing your patients as victims, of looking at parents as perpetrators, and yourself as the rescuer, right? This is not going to ultimately serve your patient's well-being. So I hope this is provocative. It's helping you think, and I invite, again, your comments and feedback. Thanks.